تحليل برا؟
وللأسف يعني احنا بدنا نساعدك بس الشيء مش بإيدينا يعني الشيء أكبر منا.
At this hospital, the wait is no longer just for treatment. It's for answers. Hala is racing between hospitals trying to find a critical blood test for her daughter. She's been coming back for days. Each time, the same response. The test cannot be done.
My daughter recently suffered a miscarriage. We took her to the hospital for a uterine cleaning procedure, and a week later, we returned for follow-up tests. We first went to Patients' Friends Hospital, but the tests weren't available there. Then we came to Al Shifa Hospital, and they weren't available there either. I checked with all the laboratories, and I still don't know where we're supposed to go.
Across the Gaza Strip, testing labs are running out of the supplies needed to function. According to the Ministry of Health in Gaza, around 86% of essential materials are already depleted. Some tests, like the blood gas analysis, critical for emergency and intensive care, are no longer available in certain hospitals. At facilities like a Shifa hospital, majority of supplies for these tests have already run out completely. Elsewhere, remaining stock is expected to last only a few days.
Since the ceasefire began, particularly over the past 6 months, we've been facing a severe shortage of supplies needed for medical testing.
For doctors, the consequences are immediate. Without test results, treatment becomes guesswork. Patients with chronic conditions cannot be monitored, emergency cases face delays, surgeries carry greater risk.
Unfortunately, conditions have worsened, with deaths increasing due to delays in diagnostic testing. There's also a severe shortage of blood bank supplies, blood donations, and the testing materials needed to screen donated blood, largely because of the famine conditions people have endured.
For Hala, the uncertainty is overwhelming. The diagnosis is delayed, treatment is on hold, and the conditions of her daughter, whatever it may be, remains unknown. This is a healthcare system under strain, not from the number of patients, but from the loss of tools and equipment needed to treat them. Without urgent resupply, doctors warn that even basic care could become impossible. For now, many here are left waiting, not just for treatment, but for the chance to even start it. Hani Mahmoud, Al Jazeera, from Gaza City, Palestine.